Although it is too early to call the COVID-19 outbreak a pandemic, countries should be in a phase of preparedness for a potential one, said the World Health Organization in a news briefing on Monday in Beijing. More than 2,000 cases have been confirmed in 29 different countries outside of China, with 23 deaths, according to the organization. So how serious is the picture outside China, especially in countries like Iran and Italy, which have seen a recent spike in cases? What from China's experiences in combating the outbreak could other countries possibly customize? I'm joined from Rome, Italy by Michele Geraci, former Undersecretary of State at the Italian Ministry of Economic Development. From Tehran, Iran by Ghanbar Naderi, a correspondent with Tehran-based Press TV. And I'm also pleased to be joined in Beijing on the phone by Victor Gao, Vice President of the Center for China and Globalization. Gentlemen, welcome to The Point. Let me go to Mr. Naderi in Tehran first. We understand that Tehran or Iran is a country that has been hit very hard by this virus, not because of the sheer number of cases reported, but because of the high number of fatality rate. And latest information we have is that Iran's Deputy Health Minister has tested positive for the coronavirus. So, Mr. Naderi, what word would you use to describe the situation in Iran, and what measures are being taken to curb the outbreak?
Well, Leo, that's a question many people are asking. I think this is the price we have to pay for globalization. This has nothing to do with China or Iran or any other country in the region and beyond. And this has everything to do with multilateralism and the fact that this is a globalized economy. You cannot stop the movement of people and businessmen between Iran and China, or between China and the United States or any other country. That's why we have the problem right now. For the time being, unfortunately, some people have lost their lives. The good news is that the government has been quick to react. I think it is going to be a shutdown of schools, universities and public places and events for the next 45 days or so, especially when it comes to the New Year holidays, which is about 15 days. So what the government is trying to do is to make sure that not many people are going to be infected. But as I told you, some people have lost their lives because we have some businessmen that are doing business with China, and they were the ones that brought the infection to the capital, Tehran, and other cities in the region. But we shouldn't, start this kind of blame game. This has nothing to do with blame game, and the fact that, as I told you, this is a globalized, economy, and that's how things are being run, not just in Iran and China, but the rest of the international civil society, especially in Europe. You are talking about Italy. It has also been affected. So we should stop trying to blame each other and start working with each other to learn from each other's experiences in order to sort out our differences and make sure that we can prevent this new problem.
Absolutely. Now, every year, millions of religious pilgrims, migrant workers, business people travel constantly in and out of Iran. For instance, the number of crossings was 30,000 in January, according to the International Organization of Migration. So what does it mean for the containment of the virus? How are things likely to go from this point on?
Leo, there hasn't been a declaration of shutdown for any city or any country for the time being. There are some pilgrims that still want to travel to Iraq and other places, and there are those who want to travel to Iran. It's very difficult to contain the movement of people right now. I think the authorities are trying to help, but at the end of the day, we haven't had this kind of, red alert, issued by the government officials and the health and the health officials of this country. But if you are asking me, I think it's very difficult to contain the movement of people right now.
Yeah.
We have to wait and see, because as I told you, all the government has been able to do right now is to ban the sale of selling masks and at the same time asking people to take precautionary measures and not to travel at the same time. So it's a waiting game. We have to wait and see. This is just the earliest stages of the outbreak in Iran.
Colonia might help, by the way, because it contains alcohol, as we are seeing from the images. Finally, Mr. Naderi, one more question, and try to be brief. Given the U.S. sanctions that's in place in Iran, what kind of challenge does that pose? Is there any possibility that at times of such humanitarian needs that the sanctions could be considered to be, at least there could be a dialogue for some of the sanctions to go temporarily so that the people can deal with the potential crisis?
Yeah, that's a good question. Cutting to the chase, we are under sanctions and restrictions by the United States government. We have the problem that is going to affect our health sector. We only have about 15 detection kits right now with regard to detecting the outbreak of coronavirus. I think the time is now for the U.S. government to come to its senses and relieve or lower the sanctions regime for the time being in order to help Iran to get more detection kits into the country and avoid or prevent the spread of the disease. That's all I can say. I think the government of the United States should help us right now in these desperate hours.
Yeah. Well, definitely. Let me go to Mr. Geraci standing by from Italy. Now, we know that the number of confirmed cases have jumped from 3 to at least 229 in 4 days over the weekend, and at least 7 related deaths have been reported, mostly in northern Italy. And Mr. Geraci, how serious is the situation in Italy, according to you, and what's being done to help people stay calm and fight the virus?
Well, these numbers that you have mentioned have caught the public opinion and even the current government by surprise. By the Italian government's own admittance, they were surprised about this high jump in the numbers. Of course, it seems that not all of the 200+ people affected have fallen ill over the weekend, but hopefully over the last few days. And this is just the stock of people who have caught the disease, but is a result of an accumulation process that has started probably 2 weeks ago. In that respect, one should not read too much in the growth in numbers from, let's say, Friday to Saturday, because it's just almost an accounting thing. The reaction, of course, of the public has been a mixed surprise. You probably saw the news of some shops in Milan being emptied of goods. The government has taken some measures to quarantine the 2 areas that have been mostly affected by this. There have been some travel bans, restrictions. In a way, what I have tried to do is to also look at what China has done in Wuhan, in Hubei, and in the rest of the country, to see what lessons we can learn. China has, in a way, a head start. You have been dealing with this issue almost 2 months ago, a month and a half ago, since mid-January. So surely there are things that we can learn. And so that's why I'm pushing for the 2 governments to open a dialogue. Surely we cannot, we don't have the capability to build a hospital in a few days, but we can see about the measures and also information about the severity of the virus.
That's a great initiative. Are the people being sufficiently updated on the nature of this virus, however, on the media, on the TV, on social media? Because this is very important so that people understand what kind of risk they have. By staying at home for 1 week, for instance, is not enough.
It's indeed, we have a 2 weeks incubation period. The people are aware of it, but the general narrative is that the virus spreads easily, but the danger is very low, and the mortality rate tends to be very low. So, the numbers have been floating around is about 80% of people do not really experience any major symptoms, 20% have some serious symptoms, and only about 2% die. And the 7 people that unfortunately have passed away in Italy, they were relatively old without a disease, so even those 7 people, it is not entirely clear that they died because of the virus. Having said that, of course, that's very good news, but this sparks a little bit of anxiety. Face masks are now not available in Italy any longer. They were not available also a few days ago when we were trying to buy them to ship them to China, because obviously China needed them most at the time.
No, people should not be doing that anymore. Yeah, you should keep it for yourselves, really.
We should, maybe you should send them back to us now that it seems likely that the situation in China seems to ease out a little bit, at least from my here, from my, you can tell me more from Shanghai and even Zhejiang province.
Let me ask you this, Michele, before we run out of time. Let me ask you this. The Schengen area, the Schengen arrangement allows people to travel freely between countries which are within the scheme. Now, some countries have taken some measures, but are you concerned that the situation might get worse because of the connectivity of people Schengen-wise?
Experts say that the only way to contain is to quarantine, and nothing else works. So I would be very much in favor to block the Schengen system. Remember, blocking Schengen does not mean that people cannot travel. It just means that they have to line up and have passport check and maybe, in this situation, temperature check.
So that people can trace
in no way
everybody.
This means closing off.
Right.
People trade. Doesn't mean to block the flow of people. Of course, we want to continue to do that, but we just want to make sure we check. And this is also in the interest not just of Italy, but of the other countries member of Schengen. This is what we've been doing, because every country has different ways to deal with the emergency. So it is important that some people from one country does not go into another country easily and face a different system. So just you know, for 1 or 2 weeks we can take the economic hit in exchange for the safety of the public.
Let me bring in my third guest, Victor Gao, Dr. Victor Gao, and I want to bring in this short soundbite from Dr. Bruce Aylward, who was leading a team of World Health Organization experts, and he said this in Beijing on Monday. Let's take a quick look at this. He said that China was the first line of defense to prevent the international spread of this virus because they feared and felt the responsibility to protect the world from the virus. Other countries should think about whether they apply something, not necessarily thorough lockdowns, but the same rigorous approach. Dr. Gao, what do you think China can share with these countries that are facing a similar situation, although on a smaller scale?
Thank you very much for having me. I think not only China, but many other countries in the world, other regions in the world are faced with the common threat of coronavirus 2019. I think for China to lock down the major city of Wuhan and almost the entirety of Hubei province, and in many other parts of China, we are doing the self-imposed quarantine to prevent the movement of people so that the coronavirus will not spread out of control. There is a lot of experience that China can share with other countries and regions. First of all, I think in this critical moment, movement of the people need to be hindered in order to prevent the spread of the virus. Secondly, early steps and urgent steps need to be taken to detect those confirmed cases, because only in this way can we prevent the spread of the virus. Thirdly, I think, as the case in Wuhan and many other parts of Hubei, medical facilities need to be set up as quickly as possible, including the modular hospital, which is easy to set up and easier to manage, because otherwise the cities or the provinces or the countries may be overwhelmed and swamped by the contracted cases and eventually leading to human tragedy. And I think another thing is international cooperation. I think WHO is really doing an excellent job in monitoring the situation and alerting the whole world about the progress of this situation and urging on international cooperation. China needs to be more proactive in this regard, not only in cooperating with WHO, but with all the other countries and regions which have witnessed spikes in the contracted cases.
All right. Thank you so much, Victor Gao, for these excellent points. And I think it is very, very important that we show solidarity as well. Now that we have seen things stabilizing, it is time to give back as well. Messages of solidarity or masks or protection gears, and most importantly, experience, tips, how we made it, and, you know, all kinds of support, whatever may be necessary and possible from the side of China to the rest of the world. Many thanks to my guests from Italy, Michele, Geraci, from Iran, Ghanbar, Naderi, and Victor Gao.